So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out.
Alrighty, chat, let's get started. We're going to talk a little bit. Welcome to another Healthy Gamer GG stream. My name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream is intended to be taken as medical advice. Everything is for educational or entertainment purposes only. If y'all have a concern or question, please go see a licensed professional. Welcome, everybody. Happy Friday. Today, we're going to be talking about some cool stuff. So let's start with actually announcements. Okay. Give me a second. So we've got, so we're in week 4 of Right in the Feels. So this is a community event where you can learn a little bit about emotional awareness, help gain some hopefully EQ. So hopefully we'll be doing some measurements and stuff for people to opt into at some point. But this is a community run event where basically every week you're going to be learning a little bit about your emotions, tracking your emotions. We've already introduced a couple of the more advanced features like empathy labs, which is an opportunity for you to try to guess what other people could be feeling and then sort of figure out if you're kind of right or wrong, right? So like level up that skill of empathy, as well as sort of reflecting on your own emotional experiences so that you can kind of learn and process and hopefully grow a little bit from it. And then we're going to be having some emotional regulation and stuff like that roll out pretty soon. Even though it's week 4, you can absolutely join now. It's kind of like never too late. And the goal is to sort of really help y'all focus on emotional development over a longitudinal period. So feel free to kind of join in and hopefully you'll get something out of it. I think the response so far has been really, really good. I think people who are consistently using it are learning a lot about their emotions. I think we oftentimes will get questions and stuff about, okay, I'm alexithymic, what do I do? Like I have difficulty understanding my internal emotional state. And so I think we've sort of designed these kinds of events to sort of help people gain some emotional awareness. Yeah. So today we're going to be talking about a couple of really cool things. So I'm going to talk to y'all a little bit about one of my favorite topics, which is going to be bipolar disorder and creativity. So there's a lot of really fascinating hypotheses and unfortunately not that much high quality research, because if you kind of think about it, like creativity is hard to study in and of itself. Bipolar disorder can be challenging to study, but studying the two can be very difficult. But we're going to share with y'all like some really interesting revelations about the intersection of creativity and bipolar disorder. And then we're going to talk a little bit about becoming a successful student. So I'd love to share with y'all kind of in a more targeted format some of the things that I learned in terms of like how to go from like a failing student to a very high performing student. And furthermore, stuff that it's not just personal experience, but I've basically been teaching or tutoring for 20 years now. And so I've taught at like every level or tutored at every level. So I've taught like high schoolers and stuff. I've also taught undergrads, medical students, and even doctors, right? So you know, I was faculty at Harvard Medical School for a couple of years. And so like, and now still like I still teach a bunch. Like I gave a guest lecture at UC Berkeley earlier this week. And so like not only kind of what I learned for myself, but what I've seen has been effective for students at every level. So I'd love to share that with y'all in a kind of more packaged way. So we're going to be talking a little bit about bipolar and creativity, and then a little bit about how to be an effective student. And thank you to everyone in chat who's, helping people who don't know what alexithymia is kind of defining it. So y'all want to get started? Okay. What do y'all want to start with? Students or bipolar? Bipolar. I'm bipolar. Give me a hi from Canada, please. I'm not in Canada. Paradox. Okay. Let's see. Okay, we can run a quick poll. Hold on. I gotta pause. Let's do poll. Oh, and then if we've got some time, I'd love to share with y'all a really interesting. Okay, cool. No, wait, this is old. Bipolar creativity or success as student. Bipolar creative success as student. Let's do it, chat. What do we want to do first? Let's see. Okay, it looks like Bipolar Creative is winning out just a little bit. I'm going to call it here before y'all troll me into 50-50 because I know that's coming. Okay, that's fine. We can do Bipolar Creative. We're going to do both, chat. Relax. So one thing that I've learned in my time as a psychiatrist is that I used to ask people, okay, like, what do y'all want to talk about today? And then depending on how many things there are, I realize like I'm always disappointing someone, right? So now what I've really tried to focus on is, giving y'all some variety, but really like committing to being able to do both. So hopefully we don't, we're close to 50-50. 84 to 83. Nice try, chat. Okay. 50-50 fake votes, dude. I cite election fraud. Starara was the... Okay. So, hold on a second. Hold on. Okay, we're good. Okay. All right. Calm down, chat. Calm down. Okay. Okay. All right. So let's go ahead and get started. If you guys are wondering what I'm doing, I've started to timing myself when I do these things because I'm focused on getting better at this stuff. Okay. All right. So hopefully it'll be on YouTube. Yeah. It's a dictatorship. It's a dictatorship masquerading as a democracy. Okay, so this is like when we ask you which one do we want to do first, chat, it's kind of like, there's this technique that I learned when I was in my pediatrics rotation, that if parents complain about, kids not listening, what you do is like, instead of telling them, hey, it's time to get dressed and leave the house, you ask the kid, which one do you want to do first? Put on your jacket or put on your shoes? And I found that this works really well in all manners of life. So sometimes when I'm seeing patients, and sometimes they'll be like kind of med seeking and they'll be like, I need more medication. I'll be like, okay, great. We can absolutely do that. We can change your medication. Which medication do you want to get rid of? And they're going to be like, wait, what? So it works really well in all manners of life. Okay. All right. So today we're going to talk a little bit about the intersection of bipolar disorder and creativity. So this is actually one of my favorite topics because I've worked with so many people who have struggled with bipolar disorder and yet have been amazingly productive as, artists in some capacity, even in categories like entrepreneurship and things like that. I've worked with a lot of people who have bipolar disorder and very creative. So this doesn't necessarily mean artistic. This means that they're really like focused on making something new. And the other challenge that I've really faced when working with people like this is that oftentimes as they engage in psychiatric treatment, they're very reluctant to do so, because if they do something like start medication, what their experience of it is it may keep the bipolar disorder in check, but they really hate what they have to give up. So they sort of feel numb. They kind of feel like emotionally like gray. That sort of creative energy seems way harder to access. that sort of like inspiration and drive really isn't there. Even some amount of like work ethic and productivity drops. They sort of feel a little bit sedated, need to sleep 8 to 10 hours a night instead of like their usual like 4 to 6. And so one of the biggest challenges that I faced as a clinician is in working with people who have bipolar disorder and really trying to manage the costs of treatment. And so what I'd love to do with y'all today is to talk a little bit about bipolar disorder and creativity. And what we're going to start with is kind of like a sort of historic perspective where people have made observations about how creative people may have had or have even been diagnosed with bipolar disorder. Then we're going to dive into a little bit about, I know this sounds kind of like a weird question, but like why human beings have bipolar disorder, right? Like why does this happen to us? So in some situations like infections, the reason we get infections is because it benefits some kind of other organism. But when it comes to something like bipolar disorder, this is actually the way that we've evolved, right? So our brains have evolved to have mood fluctuations. And for a small slice of people, about 1% of the population, maybe up as high as 3%, this particular mood fluctuation becomes so severe that it actually manifests as what we call a disorder. Now, the really tricky thing, though, is that if we look at people who are bipolar, what we'll actually discover is that oftentimes the people with bipolar disorder are actually way more creatively productive than the average population. And we'll look at some of that. So we're going to dig into a little bit about why we have bipolar disorder in the first place, or maybe some of the pieces of bipolar disorder. Then what we're going to do is dive into a little bit more of the concrete science around creativity and bipolar disorder. And we're talking about the science of both. So not just the intersection of the two, but how do we even do research on creativity? And most importantly, we're going to draw certain conclusions about, are bipolar people more creative? Does treating bipolar disorder reduce your creative output? Like, how do you kind of navigate this issue? And the last thing that we'll kind of end with is a quick perspective on sort of like kind of a final clinical perspective of what I've learned working with people who are highly talented, highly creative, have accomplished a lot, and also have bipolar disorder, and how I've seen sort of a formula for success for those two things. So essentially, to a certain degree, how to maintain your creativity while sort of having bipolar disorder, okay? So let's start with this. So we sort of know historically that there have been very creative people who have struggled with fluctuations in mood. So for example, like we kind of know that like Vincent van Gogh had periods of psychotic mania followed by like deep, deep depressions. And Van Gogh created 300 works of art that were like revolutionary in terms of, how he transformed the field of like painting and stuff like that. And then also like even to this day, his works are considered really, really fantastic. Other people who have been hypothesized to potentially be bipolar also include people like Martin Luther. This was the monk in Germany who basically started the Protestant Reformation. And there's actually some really interesting historical data, which shows that, first of all, he had periods of intense activity. And Martin Luther was the guy who put up that notice about the 95 theses that he wrote about things that were wrong with the Catholic Church. And there's even some historic evidence that when he was writing that, the kind of life he was living, he was sleeping very little, he was hypergraphic, so he was writing a ton. So he's like kind of consumed by this project. And then he also engaged in really impulsive behavior, right? So he went and he banged it up, like put it in a very public place and sort of incited the wrath of the Catholic Church by doing that. Martin Luther was also, we have historical evidence that he was also prone to deep, deep periods of depression. And so it's really interesting because it seems like he very well may have been bipolar. Now, that's kind of challenging because we can't really diagnose him now and stuff like that. But then there are also other people who are more contemporary, people like Ernest Hemingway, who, as historians and psychiatrists have kind of reviewed his autobiographical information, biographical information, also incredibly, incredibly productive, wrote some really transformative literature and very well could have been bipolar. So the first thing that we kind of know is that bipolar disorder is something that historically has been associated with a large degree of productivity. And that kind of segues into potentially why we have bipolar disorder in the first place. So one of the key things that I've kind of come to learn as a psychiatrist is that, mental illness is sort of like an amplification of a normal circuit in the brain. So for example, if we look at something like ADHD, what we kind of know about ADHD is that for some people it's very severe and very clearly a disorder. But some people get diagnosed with ADHD because their attentional style does not fit into current society. So there's some research that suggests that hunter-gatherers required a more dynamic attention. So if you're kind of like, if you're out foraging in the wilderness, you're kind of like walking down the path and you have to like attend to a bunch of stimuli. You see like animal tracks over there, you see a broken twig over there, and as you're walking, now you're kind of following whatever this, maybe you're hunting a boar or something, and then you see like a snake kind of wriggle over here on the side, and so you have to attend to a bunch of stimuli. And so one of the things that we know about ADHD is that human beings have required fluctuating levels of attention. So there are some human beings that are really prone to being like very, very like orderly and disciplined. So this kind of goes back to the hunter versus farmer hypothesis, where human beings have evolved into two attentional styles. There are the hunters that require really dynamic attention and are inputting a lot of stimuli. And there are the farmers who wake up every day, do the same thing, and they get really like bent out of shape if there's variety within their day. The hypothesis isn't really... There's a lot of scientific conflict in terms of how true this is, but we sort of do know from these kinds of explorations that mental illness appears to be a hyper amplification of functional circuits in the brain. And so if we look at bipolar disorder, okay, let's like kind of define very quickly what bipolar disorder is. So bipolar disorder are periods of time, sustained periods of time with mood fluctuations. So a lot of people think that bipolar disorder is I'm happy 1 minute and I'm sad the next minute. My mood can swing on a dime. That's not usually what we consider bipolar disorder. That's what I would call mood lability, and it can be correlated with all kinds of other stuff like playing too many video games, not getting enough sleep. There are all kinds of things that correlate with mood lability. When we're talking about bipolar disorder, we're talking about weeks of time with a sustained fluctuation in mood. So we're talking about 2 weeks of time with like an elevated mood that's characterized by euphoria, feeling really good, irritability, impulsivity, not really requiring much sleep or sleeping less, high degrees of productivity, even high degrees of like grandiosity and thinking that you can accomplish all kinds of things, right? So when I remember learning about bipolar disorder, I sort of remember thinking about someone like Martin Luther, and could I see this monk who's been like kind of lapsing into depression, then one day is like, you know what? F this, like I'm going to be impulsive. I'm going to figure out how to like change the world. The Catholic Church needs to really be knocked down a peg. And then he started writing, was in this frenzy of activity, and then like nailed something up without regard for the consequences. And I was like, oh yeah, that actually sounds a lot like my patients who are manic and have bipolar disorder. So the other thing about bipolar disorder is that there are also periods of depression. So these are weeks to months characterized by low energy levels, difficulty concentrating, oftentimes difficulty going to sleep, or sometimes even having hypersomnia, so sleeping too much, changes in appetite, so you kind of like are sluggish and slow and things like that. We also know that there are variants of bipolar disorder. So for example, true mania is like when you're sleeping very little, like maybe 0 to 2 hours a night. But we also know that there are periods of what's called hypomania. These are kind of like diet mania, okay? So these are periods of time where people are sleeping 4 to 6 hours a night, can actually be like quite productive. So when you're in true mania, all of your productivity isn't organized enough to be useful. So you may sort of like want to start projects, but you're so disorganized because your mind is all over the place that it's not actually productive. Whereas in a period of hypomania, you're still organized enough, you've got it together enough, you're not quite as grandiose, you're not quite as impulsive to where you can actually see like really productive output. So when I was, training at Mass General Hospital, we had a lot of students. So some of my colleagues were at the Harvard University Health Services Clinic. Some of my colleagues were at the MIT Health Services Clinic. Some people would go to Emerson College and sort of help students over there. And what we kind of found in all three of those places is that there was a very high degree of type 2 bipolar disorder. So I don't know that there's been a bunch of literature published about this, but definitely like anecdotally, if you wanted to work with hypomanic kids, you could go to MIT Health Services and you'd find a lot of them there. And that sort of suggests that hypomania is actually adaptive in some way, right? And so what we kind of have discovered about bipolar disorder is that if we can sort of keep the illness from going too far, that these mood fluctuations actually correlate with some amount of like productivity or even like exceptional work. So as I kind of just mentioned, if you go to Ivy League institutions, I suspect you will find bipolar disorder, especially type 2 bipolar disorder, which isn't quite so severe, at a higher rate than the average population. And we can also go back to our historical figures and kind of notice that, okay, so like Ernest Hemingway likely had bipolar disorder. And as it turns out, like that wasn't necessarily a complete loss for him, right? Did he suffer a lot because of it? Undoubtedly. But I think that's where if we really look at sort of some of the advantages of these mood fluctuations, being in really, really like depressed states, I've worked with a lot of people who've been this way. And what I sort of find is that especially when they create some kind of art, that if you think about what art is, it's the ability to convey and evoke some kind of emotion in another human being. It's a way for human beings to connect to each other across potentially centuries. And so what I've really found is that when I work with patients who have struggled a lot with mental illness, especially the mood disorders, major depressive disorder and bipolar disorder, that they understand something about the human condition because they've been in such deep, deep, dark places. I also tend to think about people like Robin Williams and just how great he was at like connecting with people. And he really like understood what it is to suffer. And so what we've kind of seen is that mood disorders like allow for some kind of creative output, at least anecdotally. We'll get to the research in a second. The other thing that we kind of know is that when there are periods of productivity, I know I'm kind of like this, where I'll get really inspired by something and then I'll really like work at it very, very heavily for an extended period of time. And then I'll kind of like burn out. But in those few days or maybe even up to a week or even like one day or 6 hours in the middle of the night, I can get a lot of work done. I can write like 10,000 words in like 4 to 6 hours if I really put my mind to it. Maybe not 10,000, maybe 1,000 words an hour. So over the course of a day, let's say. So we sort of know that historically, like we can sort of see that these fluctuations in mood may actually correlate with different kinds of output. And so it kind of makes sense that if we kind of look at it, there may be some almost advantages to mood fluctuations and being able to capitalize on some of these mood fluctuations for particular kinds of, especially creative output. There's also some people who have theorized, so people may say, okay, wait a second, Dr. K, but so I can see how being hypomanic can be an advantage because I'm sleeping less, I'm hyper-focused, I'm very productive. What about the depression? How does that help anyone? And so there are two kind of really important things to consider. The first is that for every action, there's an equal and opposite reaction, that there's no such thing as a free lunch. Even when it comes to the physiology of our human body, you can't have inspiration without expiration, right? Every time I breathe in, I have to breathe out. If I'm using up oxygen in my cells, I'm going to be producing CO2. So everything has essentially some kind of homeostatic balance. And what some people have sort of noticed, we've kind of seen this a lot, where when someone has this period of intense activity, they have to pay for it. So what's really common is that when people with bipolar disorder, when they're at the end of their hypomanic or manic state, they sort of have this depressive crash, which is almost like our body like compensating for not sleeping for days or weeks and working way too much and being cognitively so intense that we sort of like enter this crash of like low mood and we kind of enter this weird homeostatic balance. The other thing that's really interesting is especially if you look at the correlation between depression and creativity, some people have hypothesized that periods of depression are essentially periods of creative incubation. So before, the butterfly emerges from the cocoon, that caterpillar is in that cocoon and in this sort of dormant state before it kind of comes out, right? So a caterpillar like eats for a while, then goes dormant for maybe a couple weeks. I have no idea how long. And then the butterfly doesn't live very long. And so some people have hypothesized that depression sort of creates not only a balance to mania, which I think is very scientifically valid, and less scientifically known, but I think just as plausible, is that depression can actually serve as a period of like incubation. So now what we're going to do is, okay, we're tossing out all these kind of ideas. Like, okay, so what is, at the end of the day, like, how do we understand, okay, if I'm creative and bipolar, like, what does that mean for me? What's the exact correlation between being creative and bipolar? So is it a good thing? Is it a bad thing? Should I get treatment? Should I not get treatment? So now what we're going to do is dive into a lot of the research on creativity and bipolar. So the first thing that we're going to do is look at research on cohorts of people who are either very creative or have bipolar disorder. So I'll give you all an example of one study. So there was one study that looked at the Iowa Writers Workshop, which is a very, very prestigious and competitive creative writing workshop here in the United States. So this is probably the best kind of like creative writing boot camp in the US. At least it's the most prestigious. And what people did is they took people from the Iowa Creative Writing Workshop and compared them to controls. And what they found is that the rate of bipolar disorder in the Iowa Creative Writing Workshop was 30%. To give you all an example of what the rate of bipolar disorder is in the normal population is somewhere between 1 and 3%. So we're talking about anywhere between a 10 times and 30 times increase in bipolar disorder for people who are at the Iowa Creative Writing Workshop. The sample size of the study, I think, was quite small. I think they looked at like less than 20 people, but it's still kind of a really staggering finding. There are other studies, though, not just that one, that sort of corroborate this view. So one group of researchers actually looked at people who had won creative awards. So these are not people who just describe themselves as artists, but these are people who have won things like the Booker Prize or like the Screenwriters Acting Award or something like that. So they basically looked at like different kinds of professions and looked at the people who have actually won those awards. And what they found was really staggering. That essentially like a very high amount of people, so like 63%, for example, of award-winning playwrights have engaged in some kind of psychiatric treatment. Okay, so that's like kind of staggering. So these are people who not only are playwrights, but have won awards for the high quality of their plays. And almost 2/3 of them have been in some kind of, psychiatric treatment. Seems like mood disorders were the most common, but there's more detailed information there. So what we kind of know is that it really does appear like if you look at people who are highly creative, these anecdotal cases of people like Ernest Hemingway, and recently I've heard a lot of talk about this with Kanye West. Kanye West is someone who very publicly told people that he had been diagnosed with bipolar disorder and then sort of had claimed that the diagnosis wasn't accurate and then sort of has kind of flip-flopped back and sort of said, yeah, like this is something that I'm struggling with. And he's obviously very successful, very creative. And so we have these anecdotal cases, but when it really comes down to the research, it looks like there is actually strong evidence that people who are very successfully creative have an incidence of bipolar disorder that is way higher than the average population. So then kind of the next question becomes, okay, so like, how can we understand this further? Like, what exactly is creativity? What's the relationship between creativity and bipolar disorder? Because as we also know from both recent things as well as ancient or like historic things, as well as like old cases of this, that a lot of these people will really suffer and struggle. Many of them will end up committing suicide. Many of them will end up engaging in substance use. So what do we really understand? Like, does this mean that if I'm a creative, like I have to like sacrifice my life for the sake of bipolar disorder to really achieve as a creative person? And the answer, thankfully, is no, and we'll get to that towards the end. But what I'd love to do with y'all now is share a little bit about the science of creativity, as well as the science of bipolar disorder. And as we tunnel down into that, what we'll actually kind of like discover is a road forward that can sort of optimize creativity as well as keep the bipolar disorder in check. So we're going to start by talking a little bit about the science of creativity, okay? So the first thing that I kind of want to point out is I encountered one really good definition of creativity. So I think the best definition of creativity that I've found is framework transcending meaningful productivity. And so what does that mean? So the first thing is that it's meaningful productivity. So it's productivity that actually like amounts to something, right? It's not just ideas, but it's something that is actually like results in something meaningful and you actually produce some kind of output. But we can have meaningful productivity without creativity, right? So if I have to do 1,000 math problems or if I have to, let's say run some financial analysis, I'm operating within a particular framework and I can be meaningfully productive. So what we call creativity is when we transcend frameworks and are still meaningfully productive. So this isn't just transcending frameworks and then failing. This is thinking outside of the box and still accomplishing solutions. So the best definition that I've encountered of creativity, and that's kind of how we're defining it going forward, is framework transcending meaningful productivity. The next thing that we're going to talk about is when we talk about creativity, it's really hard to study, but there are two major, ways to look at creativity. One is to look at like creative temperament or creative impulses, or what I would call innate creativity, right? So how likely are you to think outside of the box? And the other really cool thing about creativity research is that there's a separate arm of creativity research, which is looking at creative output. So one kind of assessment looks at, okay, how creative are you? How likely are you to think outside of the box? And the other assessment is how much stuff do you actually produce, right? So those are two different things. One person can be very creative, but their creativity can never really amount to much because they don't know how to kind of focus it. They don't know how to channel it. They don't know how to produce with it. And a really good example of this is some people have sort of looked at the relationship between IQ and creativity. And what we tend to find is that IQ in some ways may correlate with that innate creativity. But as I'm sure all the gifted kids who are listening to this have discovered, being smart isn't enough to create creative accomplishment. So IQ may correlate on some level, but even that correlation is kind of weak. So it looks like that this innate out-of-the-box thinking is not quite raw IQ, and that these two things are actually separate. But those two things are closer correlated than actual creative accomplishment. So people with high IQ actually aren't really any more likely to produce something creative than the average population. And in some ways, I think they're actually hindered because since they avoid building good habits because of their IQ, it actually leads to a disconnect that makes it harder for them to actually be creatively productive. But that's a conversation for a different day. So just to kind of summarize, when we're looking at creativity research, we're kind of talking about creative impulses or creative personality and creative output. When it comes to bipolar disorder, we've also got a couple of interesting dimensions that research can look at. So the first is a tendency for mood swings, which may not necessarily impair function. So if we look at people who have bipolar disorder and we measure their personality, so this isn't an illness, this is just how their mind is kind of organized, what we tend to find is that these people have fluctuations in mood. So their mood is less tranquil than the average person. The other thing that's kind of interesting is that we can look at a group of people who have high degrees of mood swing fluctuation, but may not quite cross the bridge over to a true bipolar disorder. So these are people that will have mood fluctuations, but it doesn't quite impair their function, doesn't really cause problems. They don't really fail out of school because of their mood fluctuations, but they definitely have periods of time where they're like really, really productive and periods of time where it's like really hard to get stuff done. The other really interesting thing is it seems that people with kind of this mood swing personality, in some cases, will develop bipolar disorder. So this is a concept in psychiatry called a prodrome, which is that if you look at someone who gets diagnosed with a mental illness, let's say at year 25, if you actually do a very detailed analysis of their history, what you find is that 6, 8, 10 years ago, they started to have signs of this illness. So even though someone gets diagnosed with bipolar disorder, let's say at the age of 25, 15 years ago, they started to experience these fluctuations in mood. And over time, the fluctuations in mood got more and more severe. And eventually 10 years later, and even during like college, for example, they could keep it in check. And they did really, really well in college because they were maybe a little bit hypomanic, but very grandiose, or not very grandiose, a little bit grandiose, super confident in themselves, super productive, were kind of go-getters. And you can actually like detect the early stages of what could one day grow into bipolar disorder earlier. And so what we sort of look at in bipolar disorder, and the studies will kind of measure this because we have instruments to measure clinical bipolar disorder, but we also have instruments to measure these like mood swings that may not quite be illness. And so then what happens is as we look at the intersection of these two things, we start to discover some really, really, really interesting stuff, okay? And here's really the meat of what we're going to talk about today. The first is that having a creative temperament is strongly associated with those mood fluctuations, okay? So like, this isn't creative output yet. This is just people who are very creative seem to have more fluctuations in mood, but we haven't quite crossed the bridge over into illness yet. The other really interesting thing is that fluctuations in mood also correlate with creative accomplishment. So not only are these people innately more creative, but it seems that those kinds of fluctuations in mood actually result in more creative output, right? So when I have these periods of time where I get inspired and I'm really, really focused on something and I work really hard, work really hard, I actually make something. I have something to show for it at the end. And then since I've been really burning the candle from both ends, you know, really grinding really hard, I kind of lapse into this like period of like being sedentary, kind of chilling out, like maybe this incubatory period, this kind of like mild mood fluctuation. There's also a diagnosis called cyclothymia, which correlates with a lot of this stuff, which is sort of like bipolar disorder light. And so it's kind of like smaller mood fluctuations that can be more common. And so it's kind of interesting because it seems that like these natural mood fluctuations, which may be hard for someone to go through, can actually correlate with creative output. The really interesting thing is that once you cross the bridge into bipolar disorder, the innate creativity association is still there. So if you look at people who have bipolar disorder, they're still very, very innately creative in terms of the way that they think, in terms of the way their personality is, but the creative accomplishment actually tanks. And this has been my experience as a clinician, which is that even if you're kind of hyper productive while you're hypomanic, the price that you pay for that hypomania is almost never worth it. And so what we sort of find from bipolar research is that when you really cross the bridge into true bipolar disorder, and we'll talk about how that happens or what the risk factors are there in a second, that once we cross that bridge, the actual creative output goes down. And so I think that's a really important kind of target, because what I've sort of found working with people is that we want to sort of almost allow some amount of those mood swings. That's probably something about the way that like people's brains have evolved, like creative types, is that they need these kind of mood swings to capitalize on their kind of creative impulses. But that if we're not careful and we let those mood swings get out of whack, they'll cross a particular threshold to where our creative output actually plummets. And at that point, it doesn't actually help us. And so what I've sort of discovered working with these people, and now kind of transitioning to like my experience of working with these people, is first of all, the benefits of a real bipolar disorder are almost never worth the costs. So that's kind of conclusion number one. That sure, you can be hypomanic for the month before finals and get a 4.0 GPA, but the 6 months of depressive crash and how much you struggle for the next 2 semesters is not worth it. That's been a general conclusion I found. Even in terms of people who are artists, that really giving into that true like mania is not worth the depressive crash that comes afterward, because a lot of times what will happen is they won't complete the projects, right? You get 80% of the way done. Like let's say you started to become manic in January. By March, you've really built 80% of something. And then you become depressed for a year. And by the time January of the next year rolls around, like that project has been collecting dust. You've lost all of your creative inspiration. You never actually sold any artwork. You didn't actually have a show because you were so depressed. People were calling you. They were so excited. You didn't even answer phone calls. That on balance, it's almost never worth it. The other thing to kind of consider here is that as we sort of realize that, what a lot of people will kind of do is encourage treatment for bipolar disorder, which I'm in favor of. But then we run into another problem, especially when we look at medication management for bipolar disorder, which is that when people take medications for bipolar disorder, what they end up sort of feeling, some of them, the unlucky ones, is like relatively numb. They sort of don't feel like themselves. I've heard people describe it as like, I'm kind of a shell of myself. That creative energy just isn't there. Like I can sit down and I can actually go through the motions of, let's say, drawing or writing poetry or painting or something like that. But like, it feels like I'm just going through the motions. There's no real like life or vivacity kind of like injected into my artwork. And so what people really struggle with when they're on medication for bipolar disorder is that like, okay, so like now I kind of feel like damned if I do, damned if I don't. If I'm on medication, that means that I'm going to live a life that's kind of like drab and like, sure, things aren't going to be falling apart. I'm not going to be getting kicked out of my apartment. But at the same time, like I can't really capitalize on my creative impulses. And so what I've really found is very effective in this situation is to remember, first of all, a couple of things. One is that medication is not the only treatment for bipolar disorder. In fact, the best treatment, in my clinical opinion, the best treatment for bipolar disorder is sleep. That really, if you want to scale back on medication, what people with bipolar disorder really have to do is put a lot of discipline or boundaries around other parts of their lives. So I've worked with people who, for example, would start medication only when they were traveling internationally. And as long as they were disciplined enough and getting enough sleep, we'd be monitoring them on a regular basis, right? So we'd have like monthly check-ins, hey, are things getting out of whack, or things stressed out, whatever. But that you can actually reduce medication. And I've found this a lot, that like really like you can be creative, be bipolar and find some degree of medication balance that allows you to be creative and yet doesn't cause you to be like really high risk for relapse. The challenge is that most people who are bipolar, the price they have to pay for that really sweet spot and walking that tightrope is actually like disciplining your life in other ways. It means doing things like cutting out substances, which will increase the risk for bipolar disorder. And now we're going to get to something that's really important, which is if you kind of like ask me from a clinical perspective, what determines whether those mood swings cross over into bipolar disorder? I would say it's all of that other stuff. So if you use substances, if you don't have a regular sleep schedule, if you don't have good nutrition and exercise, and if you don't meditate, all of those things are risk factors to cross the bridge. And so the big thing that I've really found working with people like this, and this is where honestly, like my top recommendation would be, if this is resonating with you, to absolutely see a mental health professional, like go see a doctor, because this is actually what we're there for. We're not there to medicate your bipolar disorder or medicate your creativity into oblivion. We're there to help you figure out in a very personal and individualized way, how can we help you build a life using medication, using psychotherapy, using meditation, using good sleep hygiene, using motivational interviewing to stop drinking alcohol, stop smoking pot, stop using these substances like amphetamines and stimulants and cocaine and abusing Adderall and all this other crap. How can we help you get all of that stuff under control so that you can create? The other thing that I sort of found as a psychiatrist, so I was at McLean Hospital at the time, and so I was talking with actually the head of McLean Hospital, and I was telling them that, hey, I've got these patients, and I think our psychotherapy is kind of like, I feel like I don't know exactly how to help them create art. Like, so I can manage their pathology on some level, but I was like, when it comes to really like allowing them to really foster their creativity, like, do you have any suggestions for that? And what I thought was really interesting is the head of McLean Hospital, right? So there's a professor of psychiatry at Harvard Medical School. That's when they pointed me to the Institute of Coaching. So this was a branch of McLean Hospital, which is the number 1 or number 2 psychiatric hospital in the United States. And he was kind of saying that, okay, we have this division that's not really focused on just treating illness, but is really focused on helping like people live their best lives. And so it was actually started by another faculty member at McLean Hospital who focused on positive psychology and then sort of like crossed the bridge over into coaching. And that was actually my first exposure to coaching. And what I discovered was really interesting is that there's actually like a methodology that is designed to help people like achieve as opposed to focusing on fixing problems. And those are two different things. And so this is the kind of situation where like, if you are someone who is struggling with being creative and having mood swings, if you're someone who's struggling with being over-medicated or medicated for bipolar disorder, what I would strongly, strongly encourage you to do is, if you haven't seen a clinician, to absolutely see a clinician. The second thing is to work with your doctor to really explain to them, okay, these are my goals. Like, I actually do want to create, these are the challenges with the medication. And this is where I hope you find a really good doctor, because hopefully the answer isn't just let's change your medication. Hopefully the answer is, okay, let's think a little bit about your life. Let's think a little bit about what your goals are. And let's try to develop a multidisciplinary plan to help reduce the medication burden as much as possible, but also put other kinds of safeguards in place. And if you can find a clinician like that, then I think you're hopefully that's the kind of person that you should be looking for. And it's not just about finding that kind of clinician, it's also vocalizing to that doctor, that psychiatrist, hey, these are my goals. Can you help me in these dimensions or not? And this is where sometimes what we've also seen is like a complementary, kind of going back to the coaching thing, that what I sort of discovered there was that with my patients with bipolar disorder, the more that I learned about coaching, the more I sort of got better at handling that latter piece, which was really a lot better of a fit with my style, even as a psychiatrist, which is kind of why my mentor kind of recommended that to me. So I think, it's just to kind of summarize, the relationship between bipolar disorder and creativity is really well known. It's been there historically. We're talking about people like Martin Luther, people like Van Gogh, people like Ernest Hemingway. And it turns out that science and research into this has actually corroborated what historians have hypothesized, which is that being creative and having mood fluctuations seem to actually be synergistic. The key thing to remember, though, is that there's innate creativity, but turning that innate creativity into creative accomplishment can be fostered by these mood swings, these periods of time with like increased productivity, these periods of time with sort of depressive incubation. But if you're not careful and you cross the bridge over into a true disorder, or your bipolar disorder gets uncontrolled and is no longer in remission, then what we see is a plunging of actual creative output. So if you're sort of in this situation, I'd strongly recommend that you work with a clinician. I'd strongly recommend that when you're working with that clinician to really emphasize what your goals are, which is not just to get my bipolar into remission, but to treat my bipolar in a particular way that allows me to actually optimize my creative process. And the more that you're able to do that, and to kind of acknowledge that not all clinicians are trained in that or comfortable with that, or patients won't be satisfied with that, to really consider reaching beyond clinicians or psychiatry in that case, and maybe look at something like coaching. But in no way am I suggesting that coaching should be used as a substitute. In fact, the ideal scenario is that you can find an actual clinician or therapist that can support you in those creative endeavors, which I've seen a ton of, I want to say half of therapists should be able to do that. So hopefully that's been helpful. Hopefully it's been, pretty elucidating about a really fascinating topic of even looking at kind of why does bipolar disorder exist? Well, it turns out that those inherent mood fluctuations may actually help us with creativity, and that those traits may have actually been selected by evolution, but at some point maybe they kind of get amplified a bit too much, or life circumstances like not sleeping enough or using substances can kind of take that very, very delicate mood swing creativity balance and tip it over into illness. So let's open up for questions. Okay, so Dr. Garbanzo is asking, what happens when you have to get things done during these periods of cocooning? It's a great question. So sometimes what happens is you suffer, right? So let's remember that these periods of cocooning are not necessarily ideal. It's just as people have started to ask themselves, okay, is there any advantage? We're not saying that on balance it's a good thing, okay? But is there any benefit to depression? And as people have looked at creative people and they've found a high correlation with depression, they started scratching their heads and they're wondering, okay, wait a second. How is it that like the likelihood of depression is so much higher in people who are creatively productive? And by working with those people and sort of hypothesizing, one hypothesis they came up with is that, okay, maybe this is like some kind of creative incubation. And this is why it's really important to work with someone like a psychiatrist, because how can you keep the cocooning from damaging other dimensions of your life? That's really hard. And that's why I think like good clinical help that's exactly what it's for. And what I really found is that even after a period of like, hypomanic productivity, during which those patients don't come to my office, right? Because they're too busy and canceling appointments. And I'm like, oh shit, not again. And then they show up like 3 weeks later and they've crashed. And they're like, now help me, Dr. K. And I'm like, all right, let's first understand, what did you do well? Okay, so like, what have you been working on? Okay, like my primary goal with that person is, how can we keep you safe and start working towards health without ruining everything that you've done? So you've made this deep, deep sacrifice, triggered a depressive crash, and that sacrifice has paid for these 14 pieces of artwork. So how can we support you in not letting those things fall apart now that you're depressed? It's a really hard thing to do, but frankly, work that I found incredibly gratifying. Do manic and hypomanic episodes damage the brain? What a great question. The short answer is we're not 100% sure, but I suspect that the answer is yes. So we also know that people with bipolar disorder will go through a clinical, what we almost call like burning out. So what we sort of see in bipolar disorder is that when people are young, the intensity of their manic episodes and depressive episodes are like really, really high. And then as they get older, as they get into 50s and 60s and stuff, like you can sort of see like less intensity of both. And I mean, I don't really know, but I can't imagine, how can I say this? When the body goes into extremes, it usually is not ideal, right? Like it usually causes some kind of like macroscopic damage over time. So I'll give you all just a simple example of this. So if we look at like stress, so if I'm super stressed for 6 months, does that damage something? Well, like after the 6 months, for the next, year, if I'm totally fine, like I may do a lot better. Like maybe my alopecia gets better. Maybe my hair stops falling out, whatever. But during that 6-month period of stress, we do know that, for example, atherosclerosis, which is the hardening of the arteries that tends to lead to things like high blood pressure and heart attacks and stuff like that, is worse during that 6-month period. So what we sort of know is that during that phase, I do suspect that there is damage being done. Not to say that that damage can't be repaired, not to say that you can't recover from it, but like my gut tells me that that is not healthy to go through repeated episodes. I think that like that's going to catch up with you. There'll be a price to pay. Great question. Do bipolar antipsychotic medications cause damage to the brain? Not necessarily. Not that I know of. I don't really think about damage to the brain as a major concern for antipsychotic medications that are prescribed to people with bipolar disorder. Now, we do know that some antipsychotic medications can interfere with parts of the brain, right? So we know that, for example, antipsychotics can increase Parkinsonian symptoms. So it can sometimes cause like motor problems and stuff like that. But thankfully, if you stop the medication, chances are that the side effects will go away. But we do know that there are cases, especially with the older antipsychotics, of something called tardive dyskinesia, which is a permanent alteration even after you stop the medication. And the risk of tardive dyskinesia correlates with total lifetime dosage of first-generation antipsychotic. So if you're on like Haldol or haloperidol for 30 years at a high dose, your risk of tardive dyskinesia is quite high. Whereas if you're on it for like 6 months and then you take a break for 2 years and then you're on it for 6 months, it's incredibly and infinitesimally low. Good question, though. If I accidentally missed your question, then ask it again, I guess. I don't know. I mean, I just don't have time to answer all of them. And how much time will we get to the student topic? In 5 minutes. So what to do when the medicated medications for bipolar but continue to feel numb and low-key depressed? So that's when I think you should have a conversation with your doctor about it and say, hey, like, I'm continuing to feel like numb and depressed. Like, what would you recommend? Right? So I want to keep my bipolar disorder in check, but I'm wondering if there's like other options, either different medication or less medication or other kinds of things. And we do know, for example, that psychotherapy can be effective for bipolar disorder. Like I said, I think just my clinical sense, and I'm sure that, I mean, there's got to be data to support this. I haven't looked at these studies recently, but for example, like good sleep hygiene is very protective against bipolar disorder. So that's the kind of stuff where it's like you should ask yourself, am I using substances? Am I sleeping 8 or 9 hours a night? Am I exercising? As you optimize all that stuff, it's been my experience as a clinician that the need for medication goes down. And depending on the person, some people may need to be on medication despite doing everything right. Some people can actually stop medication. And some people, you know, medication is easier than doing all the other stuff. And some people, like I said, I've had patients where we'll start medication in a very targeted and focused manner around particular times that are high stress or could interfere with their sleep and stuff like that. But I've had several patients who have had tried and true bipolar disorder who have been stable in remission without any medication for a period of, or no long-term medication for a period of years. I've absolutely seen that. Can lithium damage the body over time? Yes. So this is something that there's actually a very clear answer to, and the answer is yes. So we know that decades of lithium use will almost certainly damage your kidneys. So that's really the one thing that is the highest likelihood. But that's also like you can be on lithium for like 2 or 5 years and like it shouldn't do much to your kidneys. We're talking about is like people will have started lithium in the 60s or 70s, let's say, and like today, like their kidneys are really on the struggle bus. But yeah, we do know that some medications can be damaging long term. So Devil's Advocate is saying, I can speak from personal experience. Exercise and sleep are a huge help to bipolar disorder. What about SSRI damage over time? That's a topic that it deserves its own lecture because the data is evolving so much. So I still think of SSRIs as, generally speaking, a well-tolerated and safe medication. The biggest issue about SSRIs right now is the reduced, or the more we learn about them, it seems like they're less effective. So if we think about how does a clinician decide, or how does a patient decide whether I want to take a medication, it's benefit divided by risk, right? So even if you look at something like chemotherapy, does chemotherapy damage the body? 100%. It damages, it fucks the body, dude. Then why on earth do we give it? Because the benefit is huge, right? So anytime we're thinking about a medication, it's not, people ask these questions, does this damage? And then if I say yes, they're like, oh, I'm not going to take lithium then. It's the wrong way to think about it. IMO. The right way to think about it is what's the benefit versus the risk? What's the cost and what's the gain? And the trickiest thing about SSRIs is that the gain seems to be shrinking the more data that we get. Does it mean that they're not effective? No. It just means that they're not the wonder drugs that Prozac pretended to be like 50 years ago. Yeah, we'll talk about schizobipolar, but later. Let's move on to students. Okay? All right. Okay. Chat. Y'all enjoying this? Y'all having fun? I love talking about this stuff. Dude, I love so much like talking about not just like clinical stuff, but it fascinates me so much. So like, I don't even know how to say this. So what I love about psychiatry is it's like, it's not just medicine. I feel like psychiatry gets us so close to humanity. And I think it's really fascinating that, we've got something called bipolar disorder, which is absolutely can be like crippling and can ruin people's lives. Don't get me wrong. But then we have these people like Vincent van Gogh, who are like probably bipolar. And there's really strong evidence that he had psychotic mania. But then what's really kind of like, this is going to sound kind of weird, not that that's a good thing, but that something about those states of mind allow us to create particular things. And this is something that I've kind of noticed in my practice in what I call the artistic temperament, which is that when I talk to people who are like really great artists or creators, what I tend to find is that they've really struggled, or like on the inside, there's a lot of suffering. And so then the question becomes, what I really love about my job is that it's not just about removing pathology, right? It's not like I'm a surgeon and I'm just taking out the cancer. It's like following that whole continuum of, okay, how do we keep this from not screwing up your life? And furthermore, how can we take this part of you that has felt so much profound pain and turn it into something that you can be like proud of and makes you feel fulfilled in life? And it's that continuum that I really love. And what I love about psychiatry is it's not just about trauma. It's about finding meaning and like making the world a better place because of what happened to you. It's kind of like, basically psychiatry is like every time I sit with someone, it's always a redemption arc, which I really love. It's not just fixing something that's broken. It's like, let's move beyond that. It's great. It's very gratifying. And so, yeah, anyway. And one of the things that I really love is when I work with a patient and they themselves begin to realize like, oh, this is where we kind of, so I will oftentimes take a spiritual perspective. I'd say I do it in about 80 to 90% of patients. And in the 10 to 20%, we'll have a conversation up front. Hey, like, how do you feel about the spirituality stuff? And 10 to 20%, I'm like, yeah, not my thing. I'll be like, all right, cool. So then we don't talk about it. But usually people come to me because they're interested in that stuff. And then to really think about, okay, like, because, when people have bipolar disorder, a lot of times what ends up happening is like they hate it, right? Because it's an illness. It ruins their life. It's incredibly frustrating. And so what happens a lot anytime someone has an illness is they ask, why me? And then one of the things that I find the most fulfilling about my job is helping that person answer that question. Why you? Helping them realize that this is not, sure, it's an illness that's screwing up your life, but that like this is part of who you are. This makes you who you are. And the price that you pay, the sacrifice that you make for struggling with bipolar disorder can turn into something truly magnificent and can be revolutionary and alter the lives of 1 to 1 million or even 1 billion human beings. I don't know if Vincent van Gogh ever had a psychiatrist. I don't know if he ever understood when he was like in the depths of his psychotic mania and suffering and he made artwork that he would revolutionize the world of art and affect generations of human beings. But what I see when I work with patients with bipolar disorder, honestly, is that kind of creative energy. Transformative creative energy. And for like the artists, to be honest, for other people who just don't have that kind of creative energy, it's like, it's just different. Like I see this, I don't know how to, it's like, it's just energy. It's just Shakti. And when it manifests in the wrong way, it results in like psychosis and mania. But when you take the power of that creativity and you sort of channel it properly, it's really amazing to see. I love parts of my job. The unfortunate thing is there are other parts of the job that are less fun. But, you do it for the fun parts. And if you're lucky, those can be a significant part. And this is also like a huge thank you to all of the patients who have had bipolar disorder who have chosen to work, given me the privilege of being a part of their story, because it's like, they're important too. Obviously, we can't name names and stuff because of HIPAA and whatnot, but if you're out there and you're listening, you know who you are. Nope. Hexavir is asking, have we covered how to be a successful student? We have not. So we're about to start. Okay. Let me just collect my thoughts for a moment. Okay. Okay. Give me a second, chat. Okay. All good questions. I see a bunch of good questions about creativity and IQ and stuff like that. We just don't have time to get to all those. But we've got other stuff. I've got other notes in my not really hypomanic frenzy, but I got excited about creativity and so did a bunch of research. My process is usually like I'll read maybe like 20 scientific papers a week. So people usually ask me like, "Oh, Dr. K, like what books should I read?" And when people ask me like what books should I read, like I don't have great recommendations because honestly, I read a lot of books, yeah, but I'd say that most of my learning actually comes from primary literature. So I'll read like 20 papers a week, which ends up being about 100 pages of 100 to 150 pages of stuff a week. And that's really when I think, because remember, anytime you read a book, you're basically, what you're paying for usually is someone else's synthesis of a lot of material, which can be fantastic. But it's part of my creative process to actually, I don't want someone else to synthesize the material for me. I want to collect the raw data and put it together myself. And I find that to be very creatively like invigorating, right? So I'll read a couple of papers about this. I'll be like, oh, wow, this is really interesting. And then I'll kind of formulate my own ideas as opposed to like digest what other people have. And even if you look at yoga, right? So the path of like the way that the yogis understood psychology was through primary data. They like sat down and studied the mind themselves and came to their own conclusions. They were not actually standing on the shoulders of giants, which is what science is all about, right? Science is like building on what has come before you, and yoga is all about walking the whole journey yourself. Okay. So let's talk a little bit about how to be a successful student. So I get this question a lot where people will ask me like, Dr. K, how did you go from failing out of college to, studying at Harvard Medical School, teaching there, et cetera? And so I get this question like periodically, and I've answered it a lot. But today what I'd love to do with y'all is actually share my perspective on not only what worked for me, but also as I've worked with students at basically every level of education, starting with like high school students, tutoring undergrads, working with master's level students, working with medical students, and even working with resident physicians. So these are people who finished medical school and then are doing their specialty training. There are some things that I've kind of learned about what it takes to be a successful student. And so I'd love to share that with y'all. And specifically what I want to target today are a couple of qualities of a particular kind of student who is struggling. So the first is that the people that I work best with are the people that want to achieve highly. So they want to knock it out of the park, but they're not motivated to knock it out of the park. These are people who struggle to optimize, right? So since they want to achieve, but they don't have motivation, what they end up wanting to do is like optimize. They want data, they want information, they want to figure out what the answer is. They want to make it easy for themselves. And the reason they want to make it easy for themselves is because they fundamentally like don't fit with school. So something about school, either they're kind of like burnt out as students, or they get really frustrated because they feel like school is a waste of time and it's not actually doing anything. Like I'm just like learning stuff. They feel like they're kind of going through the motions. And what they always are kind of like when they come to me, the last thing that I kind of think about these students is they're looking for some kind of shift in mindset, right? So they like lack motivation, but they want to achieve. They're looking to optimize because they fundamentally don't care about school. And so what they're looking for is some kind of like complete mindset shift. They're looking for, I want to stop being this person. I want to change the way that I approach things. And if I can change the way that I approach things, then hopefully like I don't have to deal with all this crap. The motivation will come, et cetera, et cetera. So as I mentioned earlier, this is something that I've seen these students at every level. So just to give y'all a quick kind of run through of my educational experience. So I did undergrad at the University of Texas, almost failed out of college, and then also did some tutoring when I was like a fifth year senior and stuff like that. I then went and got a master's degree. Then I went to medical school at Tufts and also did some amount of tutoring there. Then I ended up matching at Harvard Medical School for residency at Mass General Hospital and McLean Hospital for psychiatry. So did 4 years of psychiatry training there. And then I continued to teach there for about 2 years afterward. And so during that period of time, I worked with students at all of those levels. And what I've actually found is that there's like, the other key thing is that I've worked with students not only at different graduate levels, but of like arguably different quality, right? So University of Texas is a good state school. Tufts Medical School is like a middle of the road, decent medical school. And Harvard is obviously considered to be one of the top institutions. And so what I actually found is that there are actually students who fit this mold at all three of these institutions. And even at the highest level of institutions, you actually have people who are kind of unmotivated, who want to achieve a lot, but are really struggling to like give it their all because they're kind of burnt out. And so what I kind of discovered is that there are 5 basic things that I've sort of done with these people consistently at every level that sort of helps them achieve that mindset shift, kind of start to optimize their studying, and really, honestly, to improve their performance. So the first thing that we're going to dive into is to ask this very simple question, which is, why are you in school? So when you ask most students why they're in school, their answer is, so I can get a good job. Their answer is, so I can get a scholarship, or so I can get into a good medical school, right? So when I'm working with undergrads, they want to get into a good medical school. When I work with medical students, I'm like, okay, why are you studying? Well, I want to get into a competitive residency. I want to be a neurosurgeon one day, right? I want to go to an Ivy League institution for residency. And so at each level, like if you ask a student, the one answer that I never hear is, I'm here to learn. Right? And so I want y'all to think about that for a second. Everyone who's in school is thinking about what comes afterward, and it's not about what I'm actually doing today. So I'm going to give y'all a simple example of this. So I was working with one student. So I had a reputation, right? So for being someone who's like helpful and supportive. So sometimes when students were really struggling, they would be sent my way. So this particular student failed a rotation, which is a big deal in medical school. Okay, so this is a medical student. So they failed a rotation. And so what that means, they have to repeat the rotation. It looks bad on their transcript because you really have to screw up pretty bad to like fail in medical school. Because remember that the medical school like wants people to go on and be successful because that increases the prestige of the medical school. So this person had failed, and I was kind of talking to them, and I asked them like, hey, why'd you, what is your understanding of why you failed? And they said, well, like, this is not really why I'm in medical school. Like, I was in a rotation that I don't really care about because this is not the kind of doctor that I want to be. I want to be a different kind of doctor. And so this happens very commonly in medical school, is that medical students will focus on the things that they want to do. Because you need to get honors, you have to get an A in the rotation that you want to go into. So you have to demonstrate to people, hey, like, I did awesome on my surgery rotation and I want to be a surgeon. Surgeons who are reviewing your application will care less about how you did in your pediatrics rotation or your psychiatry rotation because you want to be a surgeon, right? So you got to show us that you have good aptitude to be a surgeon. So it kind of makes sense. This is the way that all medical students are. They prioritize the rotations that they want to go into. So I asked this person, I was like, okay, so like, tell me a little bit about your studying. And they're like, well, I was just shooting to pass. I was just trying to not fail because it's not my specialty. I'm not going to ask for a letter. I don't have to distinguish myself here. So I just like tried to do the minimum possible and kind of like reserve my energy, or even because I'm burnt out, I don't really care about this subject. So I just tried to do the minimum possible. And it turns out that as they were shooting for the minimum possible, they ended up failing by like 1 or 2 points. So they were shooting for like a 70 and they got like a 69 or 68. And so like, I was kind of talking to this person and I just realized like, this is not the right attitude. Okay. So I asked this person, okay, like, why are you in medical school? And they're like, well, I'm in medical school because I want to, go to a prestigious residency so that I can become a neurosurgeon. Like, bro, that's not why you're in medical school. So I want you to envision a scenario. So like, why do neurosurgeons get taught psychiatry? Why do psychiatrists get taught surgery? Why do psychiatrists get taught how to deliver babies? And why do pediatricians get taught how to do chest compressions or diagnose a stroke, right? Because if I'm a pediatrician, like the likelihood that my 6-year-old patient has a stroke is infinitesimally low. Why do we teach doctors all of this random crap that has nothing to do with their profession? And what I told this person was like, look, one day you're going to be somewhere. Like you're going to be at a wedding or you're going to be on an airplane or you're going to be like at some work conference or you're going to be at a bar hanging out with your friends. And something is going to happen and someone is going to yell out in panic, is there a doctor in the room? And in that moment, which I've been in a number of times at this point, it's absolutely terrifying. Because it's like, oh crap. You don't get to say at that point, yeah, sorry, you may be having a stroke, but I'm a psychiatrist and that's not really what I'm interested in, so I can't help you. You don't get to say that. If you're stuck in an elevator with a pregnant lady when the power goes out and she starts going into birth, you don't get to say, yeah, I'm sorry, I'm a surgeon, I don't know how to deliver babies. You don't get to say that. If you're a medical doctor, you don't get to do that. And so what I tried to explain to this person, I think this person got it. I was like, you're not in medical school to match into residency. You're into medical school because one day you're going to be on a boat somewhere and someone is going to live or die. My example for this happened to me. I was on a flight and I heard this, announcement over the speaker, the PA. Is there a doctor on the plane? And then I got terrified because I was like, oh crap. What am I going to do? Like, what if I can't help this person? I waited for someone else to hit the button so that I didn't have to do anything. And they asked again, is there a doctor on the plane? We've got a medical emergency. I was like, oh shit. So I hit the button and then I go back. And then what happens is they hand you, after seeing the patient, right? They hand you a phone and then the pilot's like, do you need to oh, should I land the plane? They ask you, should I divert? Should I land the plane? And you don't get to say I don't know, I'm a psychiatrist. That's not an acceptable answer. You have to decide, do I need to tell this pilot to land this plane in a field somewhere where there's going to be an ambulance to take this person to an operating room? Are they having a heart attack or is this a panic attack? And I need to be able to tell the difference because life and death, that's why you become a medical doctor. So the first frame set shift that you need to understand is why you go to school if you want to be a good student. You don't go to school for grades. You don't go to school for jobs. You don't go to school to impress people. You go to school to, I know it's going to sound wild, to learn shit. That's why you're in school. And I want you to think for a second about what school is. So if you really think about it, what medical school is if I'm going to become a psychiatrist, I'm not actually in med school to learn psychiatry because I'm going to be studying that for 4 years. And it's going to be all psychiatry. I'm in med school to learn everything else. Because this is the only time in my life where someone is going to give a shit that I know how to deliver a baby. Is it my responsibility to deliver a baby after I leave? Potentially, absolutely. And no one is going to make sure once I leave med school, no one's going to give a shit. My mentors aren't going to care. It's not like the American Psychiatric Association or the American Board of Psychiatry and Neurology is going to email me and be like, hey, by the way, do you know how to deliver a baby? They're not going to care about that. They're going to make sure I know my psychiatry. But in terms of everything else, this is the only chance I get to learn. So for 1 to 3 months of my life, I get to learn how to deliver babies. And I better learn every possible thing that I can because you don't get to say no. Now, this is where people may say, okay, but Dr. K, that's med school. What about other schools? What about other things, right? What if I'm an undergrad engineering major? And that's where I want you to think about when you get a job. What are they going to ask you to do? They're going to ask you to work. And you're going to have to know how to do stuff. And so every class that you take is an opportunity for you to learn how to do stuff. And who knows what kind of skills you're going to need. If you become an engineer, are you going to need to know chemistry? Maybe not. But what if you need to know chemistry at some point? Are you going to crack open a chemistry textbook and learn that crap 10 years into your career? I certainly hope not. You might as well learn it now. And this is where there's a lot of stuff that people are really surprised about how to use it. There are all kinds of things like, even if you're an engineer, you need to know how to do book reports, right? Because at some point your company is going to ask you, hey, we need you to make a pitch or summarize this kind of thing for us and present something to your colleagues or present something to the boss. I certainly hope you learn how to do a book report, because that's the process of reading a bunch of crap, synthesizing it, and presenting it to another human being so that they can understand it. School is actually, I know it's staggering. The first thing to understand is school is a place for you to learn things. And this is where you don't really know what you're going to need and what you're not going to need. Thankfully, we have organizations that basically say, if you want to get an engineering job, we're going to teach you mostly engineering. We're not going to emphasize biology, but we've decided that you need to learn a little bit of philosophy. Because who knows, maybe a decade down the road, you're in your engineering job, you've done really well, but then you're feeling burnt out and you don't really know what to do. You're in a midlife crisis, and maybe it would be nice if you studied some philosophy. Because then you can lean in on your stoicism studies and stuff like that, and you can find some meaning in your life or some other kind of crap. So the first thing to understand, I know it sounds kind of bizarre, but the number one thing that I see for students who want to achieve and are unmotivated and don't feel like school is a waste of time is they don't even think about school as a place of learning. They think about school as a stepping stone to something else. That needs to change. Second mistake that I see all these students make, especially in med school, is they'll try to figure out, okay, how do I become an effective student? And so what they'll do is they'll go ask other students, what works for you, right? How did you get an A? You go to some kid with a 4.0, and you ask him, how did you get an A? And they're like, I did these note cards, I did this, I did this, I did this. And you're like, okay, cool. So this happens all the time, where students are asking other students, how do I become an effective student? And the basic problem with that is everyone's asking, people are sharing information, and does everyone get 4.0s? Of course not, right? It's not how it works. You don't just get a 4.0 after you ask some kid with a 4.0 what they used to study. Is there something to be learned from them? Absolutely. Second thing that you've got to do is take a truly personalized approach, because the methodology that they used depends on their cognitive fingerprint. Everyone's mind is a little bit different. Everyone's personality is a little bit different. If you have low conscientiousness and high neuroticism, and someone else has high conscientiousness and low neuroticism, and they develop a particular studying style because they're disciplined, and they're like, yeah, I wake up at 6 a.m. One of my best friends in med school was like this. He's to date, the most amazing student, or top 3, I would say, that I've ever seen. So this guy would wake up at 6 a.m. He'd work out. He was in great shape. He'd go to school. He got basically a 4.0, and he was a gamer. So he'd wake up at 6 a.m. and then study and stuff and be done every day at 6 p.m. He made all of his own meals at home. And then he would game from 6 to 9 every single day. I was like, bro, this is unfair. How do you do this? And so I tried to learn from him. And what I realized at some point was I'm not this guy. So you stop asking the question to other people, what do you do to get an A? And start asking yourself, what do I need to do to get an A? Stop looking for the outside and the answers outside, because it doesn't work, right? Because when you translate their formula, it's okay, what's the strategy that you have, right? If you think about a video game and you look at these pro players who are pulling this stuff off, you watch a pro game and you're like, wow, that's amazing. I want to be able to do that crap. And then you queue up and you say, I'm going to do that build. And does it work? Of course not. Because the starting materials that you have are different. You can still win a game, but you're not going to win a game by mimicking a pro. And similarly, if you want to understand how to be a successful student, ask yourself, what has worked for me in the past? Don't ask other students, how did you get an A in the class? Look at the last 10 classes you've taken. Look at the ones in which you've gotten the best grades and ask yourself, how did I get the good grades in those classes and why did I get bad grades in the other classes? So take a personalized approach. The next thing that I see a lot of students do that's a huge mistake is they focus on memorization instead of understanding. So this is really interesting, but if you look at how students learn, what you discover is that at the very beginning of a class, memorization is more efficient than understanding. So the best example of this, I think, is organic chemistry. So in organic chemistry, you learn a lot about a bunch of chemical reactions. By the end of it, you need to understand, like, let's say 300 or 500 chemical reactions. But you get taught the first 10. And the thing about the first 10 is that, like, you can memorize them. Understanding them seems like a waste of effort because it's just easy. You just memorize these 10 things. They're on the test. You get an A on the test. Easy. Then what happens over time is then 10 becomes 20, becomes 50, becomes 100, becomes 150. And then you're drowning in memorization. Same thing happens in med school. And so what if you really look at the science of learning, what we discover is that understanding with details filled in works way better than trying to brute force your way through memorization. So for example, like in med school, when I'm teaching someone like some kind of physiology, okay, what I'll sort of do is like, I'll ask, okay, like a question, like what is the purpose of the heart? Like we'll start with a question like that. Like, why do we have the heart? What is the heart for? And then people will say, okay, like the reason the heart exists is to pump blood throughout our body. Okay, great question. So then the next question becomes, what happens? Why do we have blood? Well, blood is there to deliver oxygen and nutrients. Okay, totally fine. So if I'm the heart and I'm pumping blood to some organ of my body, let's say I pump it to my brain and I use up all the oxygen, then what problem do I have? Well, the problem that you have is that now I have deoxygenated blood. Well, what are we going to do about that? Well, we got to oxygenate it. And how are we going to do that? Well, we got to pump it through the lungs. Okay, cool. So lungs is where we're going to get rid of carbon dioxide and we're going to get oxygen. And as you keep on going that way, what you'll eventually figure out is that the heart is going to need 4 chambers. Why does it need 4 chambers? Well, it needs 4 chambers because we've got to send, blood's got to do 2 things. Blood's got to deliver oxygen and get reoxygenated. And since those 2 circuits are quite different, right? Because this is where it gets kind of complicated, but I can send all of my blood to different organs and they all use the oxygen. I've got to bring all the deoxygenated blood back because I've got to somehow separate out the oxygenated blood from the deoxygenated blood because I don't want to send oxygenated blood back through the lungs because that doesn't do anything. Okay, so I've got to collect all my deoxygenated blood in one place and I have to separate out the circuits. And so that's why we have 4 chambers of the heart. That's why you have 2 circulations, you should say. And then you can understand why we have 4 chambers because the way that we pump the heart is we squeeze it. And this is where we go into other things like how the heart stretches. So the more that, because our heart is elastic, so the more we can stretch the heart, the more elasticity we're going to take advantage of and the easier it'll be to pump. So now we can understand how we go from 2 chambers to 4. And so you have to understand stuff. And then all the details will start filling in. I don't know if that was a little bit hard to understand for y'all, but like the key point here is that don't focus on memorizing. Try to like understand what's going on. So even if you're like looking at like a piece of literature, right? So and you're kind of thinking about, okay, what is this person trying to say? Why are they even writing this? Why do human beings write stuff? Why are they including these characters? Why is this character introduced halfway through the story instead of the beginning of the story? As you start to understand things, and there's good data that shows that details are easier to remember when they are pinned into understanding, because the way that our human brain is organized, it focuses on understanding, not on details. The human brain is all about generating patterns. It's the reason why we can look up at clouds in the sky and we can see animals instead of random droplets of, vaporized water. Right? What we see is animals. And why is that? It's because our brains are designed to generate patterns. So the more that we focus on understanding, the more that we're playing into our brain's natural ability to learn, which is to generate patterns. So always shoot for understanding over memorization. The 4th thing that I tend to find that a lot of these people struggle with is that they focus on they focus on outcomes instead of actions. So the best students actually focus on actions and not outcomes. So a good example of this is, remember when I asked earlier, why do we go to school? It's all outcome oriented. I need to get an A in this class. I want to get a good job. I want to get into a prestigious university. I want to get into a competitive specialty. All outcomes, 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 outcomes. So I'm going to share one piece of research with y'all that I thought was really interesting. So a group of researchers looked at students who got A's, got B's, got C's, got D's, and got F's. And then they asked the student, what is in your mind? They didn't ask about, do you use note cards or whatever. They asked, what is in the mind of a student that gets an A, and what is in the mind of the student that, let's say, gets a C? And they discovered three things. So they found out that if the students who think I want to get an A, they get mediocre grades. The students who think I need to get an A, the researchers hypothesized that if the student is desperate, that will increase the grades that they get, right? Because now I need to get an A. I absolutely need it. I need it. I need it. I need it. So since the need is increased, surely the student will work harder, study harder, and get better grades. Turns out that it actually doesn't improve their grades at all. Wanting and needing are about the same. The most common thought, or the thought that correlated the most with getting A's, is I'm going to go to the library at 3 p.m. on a Wednesday. It wasn't actually about the grades at all. The kids who get A's don't think about getting A's. They just think about what they're going to do. So instead of worrying about getting an A or impressing people or getting this letter of recommendation or being in the honor society, literally just think about what the action you're going to take is. The way that you should approach school is not to try to get a 4.0, which is what we've been conditioned to think. It's, how am I going to spend my week? How many hours am I going to do worksheets? How many hours am I going to lecture? Am I going to go to review? When am I going to go to the library? And the other really interesting thing about the data here is it's not just what you need to do, but it's bound to a when and a where as well. I'm going to study chemistry from 5 to 6 p.m. on a Wednesday. I'm going to leave the house at 7 a.m. Or this is challenging, right? Because sometimes it's hard to stick to your schedule. So this is where there are some techniques. So let's say I'm working with a college student. You go to class at 5 p.m. You go to class from, let's say, 12 to 3. So you leave the house. Then what do most kids do when they're done with class? They go straight home. Once I go home, log onto the computer, log onto this, log onto that, and then 7 p.m. rolls around. I've got crap to do. I use a bunch of willpower, try to focus, get distracted. Day goes, nighttime. Now my friends are messaging me to play games. I didn't really do anything today. So the students who are successful, when class ends, I ain't going home. I'm going straight to the library, whether I study or I don't study, whether I get distracted or don't get distracted. I'm going to sit at the library for 2 hours. Not going to open the door to distraction. And when they focus on outcomes and they add the how, the where, the when, that's when the grades improve. The last thing, and I know this is going to be kind of ironic, the last thing that I find about the best students, and this is the change that I personally went through, is the best students don't try to be the best. In fact, they kind of don't care about being the best. So when I started college, I was a pre-med. I was 18 years old. I'm the son of 2 doctors, and I'm Indian. So if you're an Indian kid in the United States, being a doctor is like very highly valued culturally. It's very impressive. And furthermore, going to places like Harvard are even more valued. So what was my goal when I entered UT, the University of Texas at Austin, a state school, the only school that I applied to and that I barely got into, right? And did I think to myself, oh, like, this is a problem. I'm not really very disciplined. My grades aren't actually that great. Like, I'm going to struggle. No, I thought to myself, I'm so smart. I'm so clever. I'm so brilliant. Like, I'm going to go to Harvard and become doctor. I was going to be the best. Because I was so brilliant, right? And I was so capable. And all I wanted was to be the best. So I proudly checked pre-med as my major. Because I was going to be someone one day. And what ended up happening? Less than a 2.0 GPA in my first year. Failed a ton of classes. I don't know if I failed any my sophomore year, but got a bunch of C's and D's my second year. And like, it really wasn't working. And then at some point, I abandoned being the best. And instead, what I did is I was like, yeah, you know what? Like, I'm just never going to be the best. It's not who I am. Instead, what I did is I focused on something. I was like, you know what? What really excites me is alternative medicine. I think it's really fascinating. I spent some time in India, studied yoga, studied meditation. I was like, wow, I know that like Western medicine is really great, but like it's shocking what I've seen in India with these folks who practice alternative medicine. They're doing some things that would be considered medical miracles. This is not physiologically or biologically possible, what they're accomplishing with this alternative medicine. My mind was blown, and I fell in love with this. So then I focused on alternative medicine, spent 7 years studying yoga and meditation and stuff like that. Then something bizarre happened. As I stopped caring about being the best and devoted myself to a particular thing that I cared about, I started doing better. And I even remember when I first applied to medical school, I was talking to one of my mentors, and I was like, I don't know if it's strategically a good idea. Or one of my mentors told me, you may not want to talk too much about alternative medicine because you're applying to medical school, and people may look at this and they may be turned off because they're like, why is this guy applying to medical school if he's like really interested in like traditional Chinese medicine and traditional Indian medicine? So the first year that I applied, I included it some, but I didn't make it the central focus of what I was doing. A couple years later, I ended up, really discovering kind of like who I was. And I was like, you know what? This is actually what I'm interested in. I don't really care if they like it or don't like it, but I'm going to be me. This is what I care about. This is what I'm passionate about. This is what I want to devote my life to. What I really want to do is integrate Western and Eastern medicine because I think they both have something to offer. While I saw some things that blew my mind in India in terms of what people are able to accomplish, I've also seen a lot of stuff where like people are diagnosed with cancer and they're like, yeah, I'm going to go on vitamin infusions and a juice diet instead of chemotherapy or surgery. They have a small cancer that hasn't metastasized. They go on their vitamin infusions. It spreads all over the body. They start chemotherapy, but it's way too late. You could have had a surgical resection with radiation and been totally fine. I saw those horror stories too. And so I applied to medical school and I said, you know what? This is who I am. This is what I'm interested in. Thankfully, I got accepted to one place and at Tufts. And at Tufts, I worked with a rheumatologist who was focused on Tai Chi and osteoarthritis and inflammatory conditions. I did research with her because that's what I was interested in. And then by the time that residency applications came around, I didn't go to Tufts because it was the best. I didn't care about being the best. I was interested in learning a particular thing. And then something really bizarre happened. I would say, let me think about this. 14 years after I started college with the goal of going to Harvard Medical School and becoming a doctor there, by a complete irony, I wound up there doing residency in psychiatry. And the most bizarre thing is over that 14 years, the one thing that I got rid of was the desire to be the best and to actually wind up there and actually focused on what I cared about. And as I put all of my energy into that instead of being the best, the irony, this is what's so bizarre about karma, is that through some positive karma, luck, entropy, call it whatever you want to, the will of God, random chance, loot box heaven, I don't even know, I somehow wound up there. And so what I've found time and time again is that a lot of students really struggle, right? Because you want to be an achiever, like you want to be the best, but you just don't have the motivation the way that other people do. And like something about school doesn't fit with you. Like you're like tired of going every day. You struggle to motivate yourself, but you're like always looking for ways to optimize, right? What's the secret? What's the magic pill that will turn things around? How can I change my mind and become a different person so that I no longer, like I can achieve all of my dreams? And the big irony is when I work with those people, and if that kind of resonates with you, then here's the advice that I would have. Start off by understanding what the purpose of school is. It's not for grades. It's not for achievement. It's actually to learn stuff. Second thing that you've got to do is recognize that formulas that work for other people will work for other people. And instead of asking yourself, how do you get an A in this class? Ask yourself, how do I get an A in this class? Look at your own instances of success in school and failure in school. Try to understand and duplicate the successes instead of looking to the outside. Third thing is that scientifically focus on understanding as opposed to memorization. Because when we're burnt out, we want to brute force our way through stuff, right? The simplest thing to do is like, I don't have the energy to understand it. I don't have time to think about it. I've got 12 hours before the test and I need to learn all this crap. As long as you're in that situation, you will never be a good student. Try to understand it. The cool thing is that that's the way that your brain will actually learn the most efficiently. The problem is that it's got a slow acceleration. So when you shift over to understanding, it's actually going to have a lower yield at the beginning. But the more that you scale, it's a scalable strategy, but it starts off slow. The next thing is to not worry about outcomes, but focus on actions. And very specifically, it's not about whether you need to get an A or not. The real question you should be asking yourself is, what are you going to study? When are you going to study it? How are you going to study it? And where are you going to study it? And as those questions get answered, and as you figure out particular ways to sort of really focus in on that, your grades will actually go up. And the last thing is, stop trying to be the best. It's all about ego. The more that you are operating from ego, the less you will actually focus on the material at hand. Because why do you want to be the best? To impress other people. Impressing other people is no sustainable way to become excellent at anything. The way that you become excellent at something is because you love it and you devote yourself to the thing. It's not about impressing other people, because then that goal is completely different. Y'all get that? There's a huge difference between knowing a particular thing inside and out and being regarded as an expert in the thing. Do y'all understand that? There's like night and day between those two things. And the best students are the ones who don't try to impress other people, but try to learn the material. So stop trying to be the best. It's all chasing your ego. Once you start chasing the ego, the vulnerability that you open yourself up to is that anytime you get a disappointment, it'll shatter your motivation. I tried so hard to get an A and I didn't get an A. And so next time around, I'm not going to try. And in that situation, think for a second. It's not about getting an A. What did you actually learn? Did you learn anything? If you learned a significant amount, that's a win. Who cares about the A? Do you understand that? Education in school is not about getting A's. It's about learning crap. And the more that you try to learn crap and the less that you try to be the best or impress someone else, the better student you will be. And this is the big irony, is once you let go of that, that's when you will achieve it. Questions? As a teaching assistant at a university, how can I best help the students I'm supposed to help? So I would try to reorient them to this. So like I said, people used to send me problematic students. And I would ask them, I would start with this question: why are you here? Right? And the more that you can, if they're saying, I'm here because I have to take this requirement. And then I would, not counter, but kind of point out to them that when someone is forced to do something, what do you think happens to the quality of their work? Right? And they'll figure out. I mean, it's not a hard question. The quality of work is crappy. When you're forced to do something, what you end up doing is the minimum acceptable. And so what you need to ask your students is why are you majoring in this stuff? What are you actually here to learn? So this is an opportunity for the next, let's say, 2 months. This is an opportunity at the end of this 2 months, you can understand this stuff or you cannot understand this stuff. I want you to really think about which one you want to do. Is understanding the material important to you, or is getting through the class important to you? And hopefully, if you ask that kind of question and you even talk to them a little bit about why are you studying engineering, what are your goals in life, this kind of stuff can all help, right? Because that contextualizes why they're studying this. And if you can help them understand that, okay, so your engineering classes, it sounds like you're passionate about engineering, but you don't care so much about physics. But like, unless you understand physics, like you're going to be lost in your engineering classes. They have to understand the value of the knowledge itself. Then you can also help them in terms of structure, right? So the when, where, how can help a lot. Great question. But what way of repetition is the most effective, or is that also person-based? Great question. There is, it is somewhat person-based, but I do not think that repetition is effective. So this is important to understand. Let me think about how to phrase this. When you take a test, what is the faculty that is being tested? It's recall. Does that make sense? So when I take a test and the test asks, what is 2 plus 2? I'm digging into a part of my mind and pulling out the answer. Okay? The problem with repetition is, what is repetition? If I read 2 plus 2 is 4, 2 plus 2 is 4, 2 plus 2 is 4, that's information going in. It's not information coming out. And so what a lot of people don't realize about repetition is repetition doesn't practice recall. It's just putting stuff in, and putting stuff in. It's not taking stuff out, taking stuff out, taking stuff out. So the real way to study is to practice recall, not repetition. So the real way to study is to ask yourself, what is 2 plus 2? If you don't know the answer, then look. Okay, 2 plus 2 is 4. And this is the other thing. There's a lot of research that shows that when you are specifically looking for an answer, when you study something, it sinks way in. Does that make sense? Like, you're much more likely to, if you get a question wrong and then go look up the answer, you're much more likely to remember it, as opposed to the first pass. Does that make sense? If I'm just reading 5 random things, my retention rate will be 20%. When I get one wrong and I go back and I'm like, oh, what was the answer to that? That's when the retention rate will go up. So you actually don't want to use repetition as the primary tool. What you actually need to test, what you need to work on if you want to succeed on a test, is recall. And repetition is the exact opposite. And so do you need to memorize some stuff? Absolutely. The second thing about recall is that recall is way easier when it's organized in the brain. So if you understand something, it's easier to slot in details than if you're just like mindlessly putting stuff in there, right? So if I gave you, like, let me put it this way. What's easier to memorize? Okay, I'm going to give you all 2 tasks. I'm going to give you a string of numbers to memorize, okay? You guys ready? The first string of numbers, well, hold on, 1, 2. Okay, I'm going to give you a string of numbers to memorize. 19872739118 is string number 1. String number 2 is 1, 2, 3, 4, 5, 6, 7, 8, 9. Which one is easier to memorize? They're both strings of 9 numbers. Why? They're both, you guys get that? The resolution of the data is the same. Right? When you say ordered, it's not ordered, it's a random association of numbers. The difference is that you are able to allot it an order. Does that make sense? It makes sense to you. I could give you a 700-digit string of numbers to memorize. And I could order the other one, and you could go from 1 to 700. You would know all 700 numbers perfectly. And that's because the information is organized in your brain. So repetition is not the key. Understanding is the key. The meta level things, that's how our human brain is built. It's how we invented gods and learned divination and looked up into the sky and saw clouds. Y'all get that? So the details can slot in. But like the more that there's an architecture that you build, the better it'll be. Is it better to stay up late night studying or to get a full night's sleep? It depends. That's a great question. So should you pull an all-nighter or should you go to sleep? So there are a couple things to consider. It depends on when. So if it's the night before the test, honestly, an all-nighter is probably better. But remember that sleep is the amount of time, is the time when we consolidate short-term memory to long-term memory. So if it's 3 nights before the test, you want to go to sleep. Because sleep, you want to think about it this way. You've got RAM and you've got your hard disk. Sleep is when you transfer stuff from your RAM to your hard disk. The problem is that you may be able to fill up your RAM a lot more and walk into the test, unload that information, and then it'll never get solidified, but you just need it for the test. So you may want to pull an all-nighter before the test or sleep less. But if you're talking about 72 hours out, you definitely want to sleep. Does that make sense? Great question. So Tech Nurse is saying, while I understand the reasoning of focusing on learning over the outcome, what about being unmotivated due to knowing class content is not preparing you for the final outcome? So I would challenge a couple of those assumptions. I'm not saying that you're wrong there, but I would say, first of all, how do you know as a student that it is not preparing you for quote unquote the final outcome? And why are you drawing the line of final outcome where you are? Right? So like, let's say that I'm in a class that the test doesn't prepare me for like my standardized board exam. And so I say to myself, well, this is useless because it doesn't prepare me for the board exam. But then but what about after the board exam? Can the information be useful there? And I think that question is precisely the challenge that I see a lot of kids do is I am studying for the particular purpose of this thing. But the whole point is that the point of learning is that it could be useful later. Right? So I was recently talking to someone at a conference who was really good at book reports. They got A's in English, but they studied something else and they were in a different kind of job for a while. And now what they do is they do technical writing and ghostwriting. And they make a ton of money, like tons of money. So they get paid like 30 to 60K per project, and they do like one project every 1 to 2 months. And so like there are all kinds of skills that were not related to their major, which now they're using all the time. And it's wild. So like, I think the challenge is don't worry about the final outcome. That's exactly what you're saying. Like you're saying, how do I get motivated when I'm thinking about the final outcome? Which is why like a piece of advice number 4 is don't worry about the outcome, focus on the action. Because as long as you're thinking about the outcome, your brain will demotivate you. Yeah, so Wanam Hyder is asking, what attitudes doing things can help you going to the library and just sitting there? What a great question. So the attitude that you need to get rid of if you have trouble just sitting there is the attitude to optimize. So we all want to be efficient. Our brain loves to be efficient. We're efficient organisms. It's why we procrastinate. We don't want to waste any time. So what ends up happening is in our search for efficiency, we search for the perfect hour of studying, and since we can't find it, we end up studying 0 hours. So how do you avoid that? You let go of efficiency. You say, it's going to be a waste of time. You don't want to waste your time. Well, I'm going to waste it anyway. You have to be willing to be inefficient, and you have to be willing to waste time. When you're willing to waste time, you will be productive, which is and it's tricky, right? And that's why people haven't figured it out yet. And as I tell you, you've got to be, you're going to spend 4 hours at the library and you're going to get half an hour of studying done. You've got to be willing to pay that price to actually go to the library. Because at the end of the day, you've got two options. You can end today with 0 minutes of studying done and being super efficient and not wasting any of your time. Or you can end the day with half an hour of studying done and it costs you 4 hours of time. And what happens is the first time you go to the library, it will be a waste of time. The second time you go to the library, it will be a waste of time. The third time you go to the library, it'll be less of a waste of time. The fourth time you go to the library, it'll be less of a waste of time. The fifth, sixth, and seventh, suddenly you'll become efficient. You'll study for 4 hours. Then something magical is going to happen. 1 month in, you're going to go to the library and you're going to be done at 2.5 hours and you get to leave. And once you reach that point, you're a different human being. So there's a really simple principle of psychology at work here. And people will use it in child rearing. And by the way, actually, so let's talk about this for a second. If you don't do that, the kids who go to the library and study efficiently, you know what their parents did? Their parents forced them to sit for 2 hours. That's what good parenting is. You know, all those kids who it's easy for them to study, the difference between you and them is not IQ. It's not being gifted. It's their parents sat them down and forced them to be inefficient. Forced the child to become efficient. The parent sat the kid down and said, for 2 hours, you're not going to get up until your homework is done. And the kid squirms and can't focus and can't focus and can't focus. Eventually, the kid realizes if I finish in 90 minutes, I can get up and play Pokemon. And then 60 minutes, I can get up and play Pokemon. And then something happens, or some 8-year-old kid comes home, does their homework all day. It's not discipline. It's conditioning. And some of us, I fall into this category, drew the short straw in life because our parents did not condition us properly. So we had to learn how to do it ourselves, which is so much harder. So someone's asking, you mentioned in a previous lecture how eliminating any distractions will force you to be productive because the brain hates being bored. So is that why going to the library is effective? Not precisely. So here's the reason why going to the library is effective, okay? When you're at home, what is the price of distraction? When I'm at home and I get distracted for 5 minutes, how long does the distraction last? So if I'm sitting here working on my computer and then I Alt-Tab and start browsing YouTube, 2 hours go by. The price of distraction is high. If I leave the room, if my roommates show up and are like, hey, you want to grab a beer? The price of distraction is high. The reason the library is effective is because the price of distraction is lower. Now, if you have your laptop there and you Alt-Tab to YouTube, it's the same difference. But the whole thing about the library is when my mind wanders, the cost of that is actually lower because eventually it's easier to return to studying. So especially if I'm at the library and I put my laptop away, I put my phone away, which is now what we have to learn how to do. Library is no longer sufficient. You have to take your technology away. I pull out my notebook, I pull out my spiral, I pull out my notes, or I have a PowerPoint open and I have it open a little bit further away from me. Then the price of that is way lower. You can afford to get distracted without it hurting you. Does that make sense? Great question. How do I take effective notes? So here's my note-taking technique. And maybe I even have old notes from med school or something so I can show y'all. What I do is I start with a piece of paper, a blank piece of paper, and I put down what I consider to be like the most foundational stuff. Okay? So I can show y'all real quick. So here's how I would take notes. So remember that. So let's understand a couple of things, okay? Okay. Let me just think about how to organize this. So the question is, how do I personally take notes? So let's think about a couple of the important principles at play about note-taking. The first is that understanding is more important than memorization. The more that you can organize the information in your mind, the more it'll stick. So I'll give you all an example. If I have 5 pieces of information and I organize, if I go through this process of turning this into this, my recall will be enhanced. This increases learning. Organizing the information for yourself drastically improves learning. If I take this from someone else, if I borrow notes from a friend and I try to memorize it through repetition, this is going to be inefficient learning. This is why people who make notes always do better on tests than people who borrow notes. Y'all get that? Simple. So you have to do the brute force cognitive work. The work is up here. It's not in repetition or things like that. And we're lazy, right? So we like to borrow someone else's beautifully organized notes and we try to memorize them. Who's going to get an A and who's going to get a B? The person who made the notes is going to get an A. So the process of organizing information in your mind is how you increase understanding and increase recall. So the way that I take notes is I start with some kind of foundational thing. So what I'll do is, let's say I'm going to draw the heart. Okay? So this is going to be the right atria, right ventricle, left atria, left ventricle. Then what I'm going to do is draw my circulatory system. Okay? So this is the peripheral circulation. This is the pulmonary circulation. And then what I do is I start like adding information to it. So this blood has high O2, low CO2. This blood has low O2, high CO2. And then by the time it gets here, this is high O2, low CO2. It's usually a little bit more organized than this. Then what I'll do is, like, once I have this foundation, okay, so then I'm going to draw a capillary over here. So this is a capillary. What is the function of the capillary? The function of the capillary is gas exchange. So at the end of this, I have low O2 and high CO2. Does that make sense? Because all the O2 is leaving and the CO2 is entering. Okay, got it. So now let me ask y'all a question. So there's another thing. So let's see. So the other thing about the capillary is that it has high resistance. Okay? So the flow rate through the capillary is low flow. Okay, so now let's understand this. If this is my capillary and I've got very slow flow of blood through the capillary, that buys time for the O2 to leave via diffusion and the CO2 to enter via diffusion. Does that make sense? Because gas exchange requires time. So what do you think would happen to the oxygen level over here if the flow became fast? Would the O2 over here be higher or lower? Do y'all get this? Or is this too much? So my point is, like, the way that I study is very like understanding based. Yes, very good. Everyone's saying less exchange and higher. Excellent. So now what I'm going to do is I'm going to point to this and I'm going to say arteriovenous malformation. And what my colleagues will do is they'll say, okay, in an arteriovenous malformation, we are going to memorize that O2 is higher than normal. But I'm not going to ever memorize that. I'm going to slot it in over here. I'm going to jot this down, and now I understand it. Which is why I haven't dealt with an arteriovenous malformation in over a decade, but I still remember it because I organize all the information. Then what I do, so once I have my anatomy and physiology, then what I'll do is add my pathology on top of this. So I'll be like, okay, here's AVMs. Okay, so here's like, for example, decreased ejection fraction is going to result in this kind of stuff. Let's say like, then I'll have maybe like some EKG stuff over here. And then what I'm going to do is I'm going to add my pharmacology on top of this. So here are the drugs. I mean, this doesn't make any sense, but okay, here's the pharm for low ejection fraction. Okay, so after someone has an MI, to boost ejection fraction, we've got, let's say, calcium-related stuff, right? We can reduce peripheral blood pressure. Okay, so like we can do this, we can do this. And for EKG stuff, here are the different kinds of medications that will fix arrhythmias. Does that make sense? So then what I do is I take my core piece of thing and then I layer stuff into it. Instead of having a page of pharmacology, a page of physiology, a page of anatomy, and a page of pathology, I put it all together. And here's the key thing. When my brain is thinking, where do medication arrhythmias go? The learning happens when I figure out where they go. Because as I look at this, I'm like, okay, where do medication arrhythmias go? Where do they belong on this? And the more that you build this, I have like these 1 pagers or 2 pagers or 3 pagers or whatever. And then like everything that I need to understand is on here. And then like all of it, I don't know how to say this, it just all clicks and then you just know it. Right? And then you do well on your tests. And then you're on your rotations. And when someone asks the question, if someone has an arteriovenous malformation, what medication do you want to give? Instead of memorizing 1,000 medications for 1,000 conditions, if I understand the pathophysiology, I can figure it out. And I can say, can I have a second to think about that? And then you know what you do? You go into Chad medical student mode. Instead of knowing the answer right away, you go into Chad medical student mode. What is Chad medical student mode? Chad medical student mode is when you think out loud. And then I say to myself, okay, so in an arteriovenous malformation, what we have is we're decreasing the resistance across the capillaries, which means we're going to have greater flow across the capillaries, which means that we're going to have, let's say, higher O2 on the other end. Right? So then I guess the issue is that the real goal is going to be we can do 2 things. So remember that in an AV malformation, what we've got is low resistance across one area, but normal capillaries everywhere else. So the resistance is high on the other side of the system. So probably what we want to do is either if there's some way to reduce the resistance across the AVM, then that could potentially work. But if we were to do something like close off the APM, then we need to make sure that there's enough capillary flow nearby to perfuse the tissues. So what I would really ask is, you're asking me what do I do with an AVM? I'm going to actually ask you, is there sufficient capillary flow nearby? If the answer is yes, I'm going to close the AVM. So you tell me, which part of the body are we talking about? And that's how you get honors in med school. You don't even know the answer, but you logic your way through it. And by the way, that may be BS. I actually don't know anything about AVM malformation. So there's a vascular surgeon out there who's like, this is stupid. Right? And the cool thing about that is that, like, even if you don't know the answer, what you still demonstrate is your reasoning. Right? So AVMs are just a terrible thing. Like, if we pick anything else, if we talk about nephrology or cardiac physiology or whatever. So if someone were to ask me, like, okay, how do we increase ejection fraction? This patient has a low ejection fraction. What do you want to do? Okay, well, let's think about what goes into ejection fraction. So it's how hard the heart is pumping. So if we think about outflow from the heart. It's the resistance of the external system compared with how hard the heart is pumping. So if we can decrease the resistance from the external system, thus decreasing the load on the heart. So I could give something like an antihypertensive medication. Or what I could do is focus on Starling's law and let the heart fill up more. So slow down the rate of beating to give more fill time. Or what I could do is actually strengthen the cardiac muscle using a calcium agent. So what I'd want to do in picking those three things is find out, does the patient have a history of hypotension? Because if they've got a history of hypotension, I don't want to give them an antihypertensive. You know, do they have histories of arrhythmias that would prevent slowing filling of the heart? I don't even know if that's a real thing. So there's a cardiologist out there that's bullshit. That's fine. I'm not a cardiologist. My point is that once you understand the information, everything kind of fits into place. Or it's through fitting, actually that's incorrect. It's through getting things to fit into place that you actually gain understanding. And this isn't just for medicine, right? This can work for anything. Like, so now I'm involved with this organization called Healthy Gamer. And I have to learn all kinds of crap that I don't normally know. Like, we've got a coaching program, right? And our coaching program is good, but how did it get good? Do I know anything about running a coaching program? Absolutely not. So what I had to do was learn. So I had to ask myself, okay, so like people are asking me for help. What am I going to do? I'm going to train some people. Then I'm asking myself the question, okay, so now that I train some people, do they do a good job? How do I know? Well, I taught them, so I sort of have a vague sense, but does that mean they're actually doing it? No, that means we need some kind of outcome measure. Then the next question becomes, okay, what kind of outcome measure? Then we do research. Then we need some way to monitor outcome measures. Then we need some way to find out who are the top performing coaches and the bottom performing coaches. How can we rank that? Then what we need to do is ask ourselves, how can we discover why the bottom performing coaches are performing at the bottom and why the top performing coaches are performing at the top? And once we discover that, then we learn, okay, so I've got 25% of my coaches that are knocking it out of the park. What are they doing differently? And then we learn what they're doing differently. And then what do we do the next time we have a new batch of coaches? We teach them what the top performing quartile was doing, and we tell them don't do what the bottom quartile was doing. And then the coaches get better. Which is why, if you look, there was recently a study that came out that looked at the connection between, like the effect size of mindfulness versus an anti-anxiety medication, and found that mindfulness is just as effective as anti-anxiety medication to treat anxiety. The effect size is about a 30% reduction in anxiety. And our coaches do somewhere between a 25 and 45% reduction in anxiety. So how did we get there? Because they're not trained to treat anxiety. We have a process of iteration and improvement. And how does that happen? That involves organizing all of this information. How are we going to create coaches that can actually be helpful? We're going to do all this. And there are all these steps in the process, and you understand it. You draw it all out. You try to figure out, where does data go? Where does this go? How do we teach? Do we teach live? Do we teach asynchronously? Do they watch videos? Do we test? So we concluded, for example, that testing knowledge is not as good as role-playing. So asking someone a multiple choice question of what should you say in this situation is not as good as having a top quartile coach sit down with a coach who's learning and role play with them for half an hour and give them feedback. So we don't have any written tests. But if you don't have written tests, how do you know what they know? Because it's actually not a good tool. Because what is the correlation between written tests and work performance? Right? So there's all kinds of stuff that you can organize this information no matter what you're doing. And as you organize it, you learn it. As you learn it, you improve. SSRIs, escitalopram. Wait, so how would you apply this for stuff that you can't visualize, like example, particular theories in psychology? Why can't you visualize them? Of course you can. So like, I mean, I think it works great for psychology. So you can look at like cognitive behavioral therapy, right? You can visualize that. There are thoughts, behaviors, emotions. You can look at Freud. There's the id, the ego, and the superego. What are the functions of each? Right? So like even like these weird abstract concepts. So I'd say that's how you understand. So when you can't visualize it and then you play with it, like that's exactly the point. You look at someone like Jung. Jung is like, okay, there's a shadow. So, all right, so we're going to start by drawing a line across the page. Here's the shadow. Here's the not shadow. What else does Jung say about the shadow? Well, Jung says that growth is usually made by looking at the shadow. Why is it hard for us to look at the shadow? Because of, let's say, defense mechanisms. So what is that line that we draw? The line that we draw gets expanded out into these 8 defense mechanisms. As long as these 8 things are operating, it's going to be hard to see the shadow. If I'm a clinician, how do I want to approach this patient? How do I get them to see the shadow? Well, which of these defense mechanisms do they have? Okay, they have these 2 defense mechanisms. These 2 defense mechanisms were represented by Anna Freud. So I'm going to go and read Anna Freud, and I'm going to write down summaries of these defense mechanisms. Does that make sense? You can absolutely represent psychological concepts. And I'd say if you're having trouble visualizing it comes at the end, not at the beginning. It is the process of forcing something into a visualization in which the learning happens. Okay, we're past time today, so we gotta wrap up. We can take a quick look at that study, though. You want to take a quick look? We can do this as our last thing. Let me see if I can find it. No, chat. Okay. Love it. All right. So let's take a quick look at a research study, if y'all are curious. So I want to talk to y'all about this study. I think it's super hype. So there was just a study that came out in the Journal of the American Medical Association that looked at mindfulness-based stress reduction versus escitalopram for treatment of adults with anxiety disorders. So this study basically found that this is a non-inferiority trial. So what that means is they were looking at 2 interventions and comparing against each other. So they were trying to figure out, is mindfulness worse than, which is not saying the same as better than, is mindfulness-based stress reduction worse than escitalopram, which is an anti-anxiety medication of the SSRI class? Is it worse than medication? And the answer they said is no, it's not worse than. That doesn't mean it's better than. It just means it's non-inferior. So why is this study actually important? So I think it's important for a couple of really major reasons. The first is that if you look at the history of studying mindfulness and mental illness, we almost never see a head-to-head trial against medication. And why is that? So if you look at the ethics of studying, like, let's say, like treatment for disorders, if we know a particular if we know a treatment works for a patient and we want to do a study, we can't deprive the patient of the treatment that we know works. So thus far, what we've really seen is all of the studies on mindfulness include mindfulness plus standard of care treatment. So what we've essentially discovered so far about mindfulness is that if we add mindfulness to an existing medication regimen, it will outperform just taking meds. But thus far, because of ethical reasons, we haven't really been able to do a whole lot of studies that suggest that allow us to take a bunch of guinea pigs and give them meditation instead of medication. So what's really cool about this study is that now that we have a bunch of information about meditation, it seems that someone was able to ethically put together a trial in which we just taught meditation as opposed to meditation plus medication. And what's really big about this is that the result that they show is that actually they're of comparable effect size. So they both result in about a 30% improvement in symptoms. And so that's a huge finding because a lot of people will ask, do I need medication for anxiety? And the answer based on this study is maybe not, right? So this is a preliminary study. We still need to see more studies about it. But I think this is really significant because we may be moving in a direction in psychiatry where we can demonstrate actually you can get remission from your symptoms or you can get treatment without ever using medication. So at the end of the day, you still want to be a little bit careful about those results. You should absolutely talk to your doctor. I've had cases of patients that have been off of all medication and have a meditation-based practice and are doing great. But I've also had patients who, when they stop their medication, even if they're meditating, especially depending on life circumstances, their anxiety can kind of come back. So you want to take this result with a grain of salt, but it's still a really, really important finding because it suggests that going forward, we may have a medication-free way of effectively treating people with anxiety disorders. Questions? Paper link? Let me send that to you all. It's in the chat. Any thoughts on Colorado's decriminalization of psilocybin? I'm really interested in seeing the public health impact over time of the decriminalization of psilocybin. How do you always find these different studies? Man, I find studies all over the place. So I read some journals. I read some aggregating websites. I browse Reddit. I get forwarded papers by colleagues of mine. A lot of times I will do searches. So that's the other big thing. I'll look for something. So for example, for today, I wanted to learn about creativity. So I'll do searches about creativity and the nature of creativity and bipolar disorder. And I also have the head of our research department at Healthy Gamer does a lot of that stuff for me. He's fantastic at that. So I'll tell him, hey, I want to give a talk about this. Here are the questions that I have. Can you find me some research papers about it? And he's awesome. He knows how to read my mind. He knows exactly what I'm looking for. Okay, who do we want to raid, chat? How do I memorize difficult words I don't use often or words from languages I don't know? I would say practice. If you want to learn a language, practice. Don't memorize. But my apologies if I'm missing something about what your goals are. So any recommendations for chat to look at research papers? Most are behind paywalls. Well, a lot of them aren't. So a couple of things. One is you can always email the author because the author doesn't get paid anything. They're happy to share the paper. That's the simplest thing you can do. But there's a lot of high quality research from publications that are not behind paywalls. I think Lancet, for example, is no longer behind a paywall. And it's one of the top 3 or 4 journals in the world. Paradox is asking, before you go, please share how to find study formulas and how to find your own. We'll do a whole talk about that. That's not a short thing. That's a long thing. But I'll thank you for asking that question. I'm going to think about it and try to get back to you. Okay, we can... Hot Chubby. Hot Chubby looks like... I don't know what they're doing, but we're going to raid Hot Chubby. Okay, y'all. We'll see y'all on Monday. Right? Have a good weekend, everybody. Y'all have a nice day, too.